Welcome back. Today is Valentine's Day. Now, time for those in love to appreciate each other. This is usually done by showering each other with gifts and presents. While this should be a day filled with happiness, couples are also warned to practice safe sex to avoid unwanted diseases. For more on this, we are joined by Dr Sima Hela, who's an obstetrician and gynaecologist. Doc, thank you so much for your time this evening and a very happy Valentine's Day to you. Now, many people see Valentine's Day as a time for romance and intimacy, but the issue of safe sexual behavior should always be top of mind. Now, over the years, there was intense education and awareness around STIs, which doesn't seem to be as vigorous lately. What's the prevalence of STI infections currently?
Good evening, Katleho, and thank you very much for having me. And good evening to the Newzroom Afrika viewers. The current prevalence, Katleho, it is a bit difficult to determine as we currently the actual current testing is very limited. So we are looking at, when we look at HPV infections, for example, we know that they are responsible for about 95% of cervical cancers. But in terms of the prevalence of other STIs, it is very difficult to actually determine them as we don't have the proper testing tools.
Why is that so, Doc? I mean, in a country where you would think that we've come so far with the advances of STIs and HIV and AIDS, why is this limitation there with regards to testing?
I think it is more of a global thing rather than a localized problem, Katleho. And what we can do, what we are currently doing is that we are making sure that we screen all the individuals that are especially deemed high risk. These are individuals that are pregnant, individuals that are currently HIV positive, individuals that have been treated for STIs, and also individuals that have multiple partners. So it's a global phenomenon. It's not actually exclusive to South Africa only.
All right. So what are some of the misconceptions, Doc, about STIs that you encounter in your practice? How can education help in reducing the stigma associated with these infections?
I think education around screening should be encouraged. Education around vaccination should be encouraged. We currently have hepatitis A, hepatitis B, and also HPV vaccines should be encouraged. The HPV vaccines they are actually administered for girls and boys from the ages of 9 to 14 years of age. So if we highly recommend screening, especially screening of of the high risk group, and annual testing for HIV, annual testing like the pap smears, and also anyone who has had the sexual debut or anyone over the age of 21, they are encouraged to have pap smears and also HPV screening. So I think those are some of the things that we can do. Some of the misconceptions that we have come across is stuff like STIs are not, it is examples like contraceptions will prevent STIs, your conventional contraceptives, whereas it's only a use of a condom that prevents about 95% of HIV and also other STIs. So what we preach all the time is that dual protection is key to the prevention of STIs rather than using one of the methods.
And are those methods easily accessible to South Africans, even those in rural areas? I mean, free condoms are handed out in public spaces, in clinics and hospitals. Do you see that access reaching the right amount of numbers?
I would say so. Katleho. I would say that at our hospitals, the government has made sure, and also at many public places, I have seen quite a lot of those free condoms, which are the latex condoms. And I've had patients complain about also allergies to latex condoms. They should know that there are other condoms that are made out of polyurethane that are really recommended for those patients that are allergic to latex. And I think our government has made efforts to provide free condoms for all.
How important is open communication, Doc, between partners when it comes to sexual health, especially around occasions like today, which is Valentine's Day?
Yes, as much as it is a day of love, romance, and giving each other gifts, talking about sexual health actually helps to establish that trust, and it helps to establish that sort of honesty, which are key to a healthy relationship. And it also helps to ensure the well-being of both partners so that they can sort of make informed decisions about their relationship moving forward.
You mentioned earlier the infections such as HPV and how they could lead to cervical cancer. What are some of the potential health consequences of untreated STIs, particularly for women? How can these STIs affect their reproductive health in the long term?
Yes, so untreated STIs, like I said, HPV is responsible for about 95% of our cervical cancer cases. And other STIs, when they are untreated, they can cause what we call upper genital tract infections. This can cause quite a few complications, like infertility. They can lead to fertility problems. They can lead to bleeding problems. They can lead to chronic pelvic pain. So it is very important that whenever someone does have a discharge, it is very important that they should actually get screened, and those individuals that are identified as high risk, they should be treated as well.
In your experience, Doc, how do cultural attitudes towards sex and relationships influence individuals' willingness to discuss STIs and even going out and seeking testing?
Yes, in my experience, what I've experienced is that in our cultures, I think it's South Africa as a whole, any sort of sexually or genital tract condition is basically a female issue, which I think we need to correct as a society as a whole. We hardly see our male counterparts actually getting treatment when the female partner has been treated. And this leads to reinfections and more complications in the future. So there's still that misconception that it's only with the female counterparts that something can go wrong and not the males. This is basically due to the fact that most males are carriers and they are not as symptomatic, whereas the females, they tend to be symptomatic.
All right. Dr. Hela, thank you so much for joining us on this Valentine's Day and just giving those nuggets of wisdom when it comes to good sexual health behavior, especially amongst our couples that are getting together today. So thank you so much for your time.